So, good afternoon, all. Welcome to today's Sun Living session on impacts of cancer on one's mental health by Hely Kansara. She's a psychologist. She is a postgraduate in clinical psychology. She has been working in the mental health field for the last 25 years with teens and adults who have experienced trauma, varied mental health diagnosis, and emotional health concerns. Hely works from a systematic, collaborative, client centered approach that incorporates attachment and solution focused perspectives. It is mindful of cultural, ethnic, and economic concerns. This helps clients acknowledge the various unique contexts which impact their lives, connect with their strengths, and learn new ways to live in wholeness. Her empathy helps create a safe, non-judgmental space where clients can process, heal, and grow. She also have a private practice called Elysium of Mind. So welcome to today's session, Hely. Over to you.
And on our today's topic of webinar, we have impacts of cancer on mental health. So generally speaking, cancer, when the word you hear cancer, it just is catastrophic. It shakes you from within. Whether it's for yourself, it's a diagnosis that's put on you, or is it for somebody that you know? Learning to know that somebody you know has cancer is devastating. Now, if you see, and studies have shown, cancer and mental health, they go hand in hand. According to researchers, it's shown that people who have cancer has past history of having chronic mental health issues like anxiety, stress, or depression. And on the other side, if you see that people who have had cancer have reported to have mental health issues like mood disorder, depression, anxiety, or distress in general. Now, it is even in the survivors as well as the people who are suffering from cancer, it is shown that approximately 40% of them have reported to have high level of anxiety to moderate level of anxiety. Whereas for 20% of people, they have shown that they have high to moderate level of depression. Now, when we say depression or anxiety, it's not in generalized, it's in a different form. It's different not only for the survivors, it's also different for the people who are going through the treatment and different for the caregivers. Generally, when we think of cancer, we generally conclude of only people who are suffering from cancer and not much about cancer survivors or who have not got done with the treatment and the caregivers or the close family relatives. But cancer impacts those mental health too. Now, so when an individual experiencing mental health symptoms due to cancer shows up at Elysium of Mind, there are several things that has been experienced. For instance, for people with anxiety. So the anxiety is not about the symptoms of how it's for regular anxiety patients. It's from rejection, fear of rejection. It's from the old self versus the new self. So when you are a cancer patient, your life before cancer is very different. And then you experience cancer, you go to several treatments, and there's an entire sense of isolation that goes around. So when that happens, your old self and new self, they become two different identities. It's like knowing two different persons. And from the isolation that you have during cancer with all your treatments and medications, and the only people that you see are your doctors and your nurses and your medical health team and probably a few of your caregivers. So when you go out there, the way you process things is very different. The way things appear to you are very different. So there's a conflict between your past self and the new self that has come after going through cancer. Similarly, for the caretakers, the person that they knew or their relative that they knew before cancer and how things changed for them is also very traumatic. Generally, it is seen that people who are unable to cope up with the trauma of suffering from cancer, be it caregivers or the survivors, they have experienced trauma which is very similar to people who have experienced PTSD. Now, PTSD is post traumatic stress disorder. So, post traumatic stress disorder is when somebody or somebody that you know have experienced trauma that is life threatening or perceived to be life threatening in any forms, be it physical, emotional, psychological, even a perceived threat. And if that is traumatic enough for you, that's altering your life realities, it's referred as PTSD, post traumatic stress disorder. It's like reliving your trauma again and again in different forms. So, the survivors as well as the caregivers have been experiencing this. Like a good number of survivors and the caregivers experience PTSD, trauma about the whole cancer situation, about the life and the isolation that cancer brings. Now, it is also worsened by anxiety and the recurrence, like every person who has cancer and is declared cancer free. After a point of time, when they started on with the lies, they have this one thought, a recurring thought, that there might be a chance of recurrence or chance of relapse. And this stops them from living their current life. It makes them question everything. It makes them thoughtful. They are in the constant state of anxiety, making things worse for them. Also, I would like to share the slide. Yeah, can you see it?
Yeah, we can.
Okay. So we see that there is a the constant overthinking that the recurrence may happen and they have to go through the same thing again and again. And a lot of times while dealing with the cancer, the amount of strength that you put, you're not even aware of the strength that you have, and you can only have like make it to get through that situation once. It's so exhausting and depleting of energy. It's physical, mental, financial, emotional, that you're not up for it to go all over again. Now, this constant overthinking and the fear of reoccurrence leads to depression. A lot of time they go down the spiral and they end up having depression. Now, even in depression, there's two kinds of depression, especially seen in people who are affected by cancer. One, the non-grief related depression that has to do with the effects of treatment, that comes with the fatigue and the chemo, that comes with the sense of powerlessness, the one that is because there was this time when you could do things and now you cannot. There is about the sense of the person that you are, your self-esteem, and the ability to not do things in a certain way, that you are dependent. Now, in another, there's grief related to functional losses. Now, grief related to functional losses is especially in cancers where a certain part of your body is removed. For certain people, only the cyst or the tumor that's growing is removed. Whereas in certain cases, certain body parts have to be removed because the cancer has spread. So in cases like that, there's grief related to it, from the loss of their body parts or their ability to do certain things. For example, in esophageal cancer, the person after the removal of tumor loses their ability to speak. Now that itself is a traumatic experience, and the whole thing where you are not unable to speak, like there was a function before and now because of this cancer, the life is changed and there's a loss of function altogether. So there's a significant effect on one's mind. There's a loss, and that does affect one's sense of personal safety, their relationship with others in terms of communicating and seeing things their way, and also the self-esteem, mainly their self-esteem. It starts from there and eventually it takes out. Also, in non-grief related, there's inflammation. So now when you're having cancer and you're going through chemotherapy or other forms of therapy, the cells the cells are basically killed. So there's a lot of inflammation that happens in the body because of the drugs, because of the chemo, because of the chemo drugs, because of the medicines that you've been taking. So there's a lot of inflammation created in body, and it does messes around with the chemicals in your body, with your hormones in the body, creating increase in amount of cortisols. Now, increase in amount of cortisols is also associated with increase in sadness or increasing in stress. So in a way, your body is acting up and it's making you experience stress. So that's like bodily stress. That's adding to your distress. Yeah. If anyone has any questions, they could raise hand and ask. Yeah. So apart from these things, there's also certain level of cognitive impairment that happens. Now, there's a term for this that's called cancer-related cognitive impairment, or CRCI. It includes changes with cancer-related cognitive impairment includes changes in one's memory, execution functions, attention, processing speed, and it is seen that it is prevalent in 30% of people who have cancer. And in people who are undergoing treatment, it is reported that almost 75% of people who are having cancer treatment or have been survivors have experienced all this loss of cognitive functions. Now, along with cancer treatment, there's a lot of chronic stress from cancer and the medications and the treatment that you take. And this all is referred as neurotoxins. All this, like the medicines that you take for nausea, contain certain chemicals in it that can cause stress to you. That's not good for your body, and it affects your cognitive abilities too. And thus, they are referred as neurotoxins. You may have heard of the word chemo brain. So, chemo brain is very real. A person who has been through cancer will experience chemo brain. Like their brain feels foggy all the time. They have problem with making decisions. Even with their memory, it's distorted a bit here and there, or there's lag in the memory. Attention and the processing, like they may take a while in comparison to the self that was before. So all of these things result in self-isolation. It also results in affecting one's self-esteem. It makes the person wonder, what am I lacking at? What have I reduced to? And all this results into isolation. They're trying to cut themselves because when they're interacting, they see these lags. And they see that people perceive them to be the normal self. And the changes that have come with this, they perceive that people are short-tempered with these things. Because obviously there's problem with the communication or the processing and everything. Now, all this that I'm telling happens at a very minute level. It's very different for the person who is experiencing these things as compared to a person who is on the other side, who's dealing with a person with cancer. Apart from this, chemotherapy or radiation also causes hearing loss to a certain percent. It does not like complete hearing loss, but it does affect one's hearing abilities. Some patients may also experience tinnitus, the ringing sound that you think. So a lot of times, the patient, when is in cancer care, they may experience like they hear ringing sound, and that's quite very distressing. It's disturbing. It also affects their hearing abilities to a point. Now, this happens because there are certain anti-emetics in the medicines that you take, and they affect one's hearing abilities and cognition. So what happens is when it affects your hearing ability, it also affects your processing abilities. Because what you hear, the way you process, and how your memory functions, the responses, it all is affected. So the communication part, it takes a lag, and hence one experiences certain self-esteem issues, and the kind of social support they have, they try to keep themselves away from it. They tend to make the circle go small. They don't feel like talking, and they tend to stay by themselves. Also, during the cancer treatment, if you have noticed, there's good amount of dehydration because due to chemotherapy, a lot of cells of your body are actually shrinked or killed. So a lot of dehydration happens. And also, since a person experiences nausea, they don't feel like eating or drinking anything as such. So there's a lot of dehydration happens. Now, you might be asking, why am I talking about dehydration? So I'll explain. Dehydration is directly linked with your cognitive abilities. A person who is dehydrated has shown that the level of problem-solving skills, the level of attending to things, the level of processing things goes down. It also affects one's ability to process things, and hence the anger and frustration takes in. And it just makes the whole process of the mental and cognitive abilities to go down by much. So it is very important that when a cancer person is undergoing through treatment, their hydration is to be taken care of, that they are hydrated, and even for the survivors to make sure that they maintain the hydration level, as well as for the caregivers. Now, the symptoms that I'm talking, I've set them in such a way that it applies not only just to the people who are taking the treatment, but for the survivors and caregivers too. The caregivers, while taking the care of the cancer patient, they may miss out on their well-being. They may miss out on taking care for themselves, be it physical or mental or emotional. They are exhausted and drained. And dehydration can add to it. It can add to their frustration. It can add to their problem-solving skills. It can affect it to their steadiness. Like, you need to be very steadfast about things when you're dealing with a cancer patient. You might need to make runs or anything. So that can be hampered. So it is necessary that you also take care of the hydration. And also, hydration helps with inflammation that is caused due to cancer treatment. So it is very important that with all the cognitive functions that are delayed or affected, we create a cognitive reserve for them, in a way how to sustain or retain them. So what is cognitive reserve? So cognitive reserve is anything that helps you keep up with your cognitive functions. Now, so when you're a person who has experienced cancer treatment, so you might see that there's a vast difference between your abilities that you had before cancer and the abilities that you have during or after that. You might see that there's a fall down in the cognitive abilities and the way you used to do things, the speed at which you did things, your mental processing, it has all slowed down. And you trying to keep up with them, you trying to maintain pace, does not help. It only leads to frustration or sometimes in crisis because you feel that you're not up to it. It affects your sense of self. It affects your sense of worth, self-worth. So trying to keep up with the old habits does not help because you have reached there. You have mastered those abilities throughout your life. It took you your span of time. And now the regression is happening at a faster rate. So keeping up, going back does not help. So what can be done? Probably the thing that can be done here is to develop cognitive functionings, to develop habits, to develop things, try new different things that can help you enrich your cognitive functions, but in a different way. Starting slow, starting differently, probably even starting from a scratch. Doing different things that are easier at your level. Doing things that are doable and manageable for you at your current stage. Like, for example, solving a puzzle. Now, probably before you loved doing puzzles and you were pro at it, and you could do all those worldly puzzles. But now it's not that easy for you. Now things have changed and you're having a hard time with them. The time it takes to solve the puzzle or the clues that come to you directly are not the same anymore. So you may drop down doing puzzles altogether for once. Or maybe you are trying too hard to get them and it's causing you frustration. The thing that you can do differently here is that if you maybe try solving puzzles in a different form, maybe a picture puzzle that you add piece by piece. A picture puzzle that you add piece by piece. Doing something like having an audiobook, something that you have read, something that drawing or art or anything that helps you with keeping up your functions. Does not let your cognitive functions delay, but rather it's like maintenance. So what happens here is when you totally are not doing anything during chemotherapy, there's not much that you can do. A lot of times you are undergoing treatment and you're exhausted, so not much is there. And there is a significant amount of cognitive depletion. So you have certain range and you're already depleted. So the amount that's left, it affects you severely. So rather, here we're trying to create a resource. So if it's depleting, there's something that we are growing here. That's called developing a cognitive reserve. This can help you form a new thing. It's like you have in your past self before cancer had certain abilities, certain things, but that's not you anymore now after cancer. So then this new person that has come after cancer is in capacity to do things in a certain way, has certain things and can be doable of certain things. This also helps you with your self-esteem, sense of self-worth, and you have something to look forward to. So all of these things about the loss of cognitive dysfunction or dehydration, they are not catastrophic as such, something that's going to drop your world down. Because for a lot of people who have cancer, they just get through the physical treatment and they're out because lack of resources or awareness. These things are not something that it would cause something that is physical and visible, but it does on a personal level, on the sense of self. It's not catastrophic or very damaging. But however, like if you don't address them, you don't attend to them, it just keeps on getting worse and worse for the person. So it's not catastrophic, it's not damaging. However, it is to be something to be sustained. Now, so far we have discussed how to go about things. Now, how to deal with them? How would you go about them? Is there anything, is there any interventions to go about things? Because now we have so far discussed that how cancer affects oneself, how does cancer affects you in different forms, what are the factors that affects cancer, and how it goes about things. But how do we treat them? So there's this technique, or there's this whole therapy. It's a form of therapy developed in the field of cancer and mental health, known as PACER. 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 P stands for physical, A stands for affectionate, C stands for cognitive, E for environmental, and R for relational. Now, physical. So how are you going to, when I say PACER, it's with to deal with the symptoms and its cause of forms. So with physical. So to deal with the physical effects, what you need to do is things that can take physically: exercise, proper nutrition, diet. So it is seen that people who have cancer are very deficient in vitamin E, vitamin A, vitamin C. So it is important that they eat food that are nutrition. They're good in nutrition, they're good in vitamins and minerals, that has good that are good antioxidants. Because it is reported that vitamin E causes significant reduction in one's anxiety and is associated with reduction in level of inflammation and improves one's mood. So including food in your diet that are superfoods, that are anti-inflammatory, that are antioxidant, can help them deal with the fatigue that comes from the treatment and from the symptomatic of the symptoms of the cancer, including foods. Omega-3. Omega-3 is another thing, another food complement. Yeah, another food complement that helps reduce the inflammation. So eating foods that are anti-inflammatory, antioxidant helps. Also, when the inflammation goes down, once oxidative stress goes down, since your oxidative stress goes down, the physical form of distress that is experienced also goes down, and it eventually helps to managing your moods to a certain level. Now, these are the things that can help you with things. There are certain things that you need also mind that can cause these things worsening, like biochemicals. The food that we eat, or through the medicine, or in some or the other forms, we are intaking biochemicals. Now, biochemicals messes with our neurotransmitters. Neurotransmitters are the cells in the brain that helps transmit messages from one place to another, from the brain to the other parts of the body, and back and forth. So these biochemicals, they mess with our neurotransmitters and causes mood disorder. So if you see most of the mood disorders, the leading cause of them is having biochemicals in your dietary or in your lifestyle. Toxins. Flavonoids are something that you might have heard of a lot. They are mostly found in plants and all the antioxidant foods. That is something that helps you beat these biochemicals in your body. They help you restore and maintain a balance. Also, it is seen that lately the amount of processed food that we consume has increased to a great extent. So cutting down on food that is processed helps. Processed food has high amount of glycemic index. Now, high glycemic index spikes up your sugar levels and increases in the amount of cortisol in your body. Now, increased amount of cortisol is linked with decrease in serotonin and dopamine. Serotonin and dopamine are the happy chemicals in your body that helps regulate your happiness. They are the reason behind you feel good. They are the feel good chemicals. Also, apart from these, a lot of cancer patients, after the treatment, when the treatment is over and everything, and they're on the path of living their regular life, tend to gain up a lot of weight. A lot of emotional eating happens, and a lot of weight is gained. Because here, there's a certain amount of isolation that goes in, and when a person is isolated, they tend to eat the emotions, they tend to do they tend to binge a lot, and it's like they're putting up the empty space that they have through food. They're making up for things through food, the sense of emptiness that they have through food, and this leads to weight gain, and in certain cases also to obesity. So maintaining and management of your not maintaining rather management of your obesity is suggested. So these are some of the things that you can do physically to manage the impact of cancer on mental health. Other things that you can do is exercise, walk, go for yoga, hydrate, have good sleep for cancer recovery. Now, you may all know the importance of exercise or yoga or movement in general. It is important that we have certain form of physical movement. Again, that is not sternness for you. That does not causes strain for you. It has to be something that does leads to movement, that does leads to physical exertion, but does not strain yourself. Something that is not straining. Something like yoga or going for walks or doing your cardio, things like this. Because doing sterners routines at this stage can again lead to stress and make your symptoms worse. Doing deep relaxation methods, deep breathing and meditation also helps you calm down. It increases the amount of oxygen in your brain and helps with your cognitive functionings. So that is much recommended. Doing deep breathing, doing relaxations, meditation. Apart from that, good sleep. Good sleep, when you say good sleep, sleep differs from person to person. There's somebody who may work their best on 6 hours of sleep. There's somebody who may work great on 7 to 8 hours of sleep. And probably there's somebody who needs 9 hours of sleep for their better functioning. That's different for different people. So it is best that you have your optimum level of sleep. Because when you don't sleep, your amount of oxidative stress increases. And the radicals in your body, the free radicals in your body, they increases. So when the free radical in your body increases, it leads to more distress. It leads to more secretion of cortisols, and hence you experience fatigue, mood swings, and it also adds to your anxiety. So it is extremely important. It is extremely important that one has good amount of sleep. And again, hydration. We have been through the whole thing and explained why hydration is important. So yeah, these things: exercise, walking, yoga, deep breathing, meditation, relaxation, good sleep, and hydration are needed. Basically, if you see, these are all the things that comes under the general sense of self-care. However, there is a scientific reason behind it. Now, moving next to affective. Now, affective refers to your emotional needs or emotional aspect. So a lot of times when talking about cancer, we miss out on the emotional aspect of the cancer, emotional aspect of cancer survivors, of the patients and the caregivers. So the emotional roller coaster that a cancer survivor experiences, a cancer patient experiences, and a caregiver experiences is extremely different. For a cancer person who is in the treatment or has just received the diagnosis are in the conflict. What next? What next? How my life is going to turn around? Or maybe the fear of death, that will I get through this? Will I not? Or possibly what my life is going to be after this. There's a constant worry, constant nagging in the brain that goes on. And that affects their sense of emotion. For the survivor, it's again very different. Now that you have survived, you probably didn't even think that you may go through this, but you have survived. Now what? Your life is totally different now, because during the cancer treatment, it's generally very long. It takes at least around 6 months to a year. For some patients, it even goes beyond, depending on the kind of cancer and the stage of cancer that you have. So there is this period of isolation where your life goes in the background, and cancer treatment and therapy is the only thing that keeps on going for you. You don't have time to wonder or think about different things. And your cancer becomes this small world for you. You only see your doctors, your nurses, your caretaker, and those hospital wards and everything. That's become your daily routine in life. So you thinking beyond them, that's a very far-fetched thing. So now, when you enter the real world, when you go in, things are different from you. The way you process things are different. In a nutshell, things are scary for you. You're scared of everything because so far you have not communicated with people. You've not been out there in the environment. Everything, it's too noisy, it's too bright. There's a lot of things going on. So it kind of creates a sensory overload for the person. It's too exhausting. At times, even going for grocery shopping, that's just like by picking 4 or 5 things is exhausting for them. They have to mentally prep themselves up when they are going for the shopping, doing things, picking things. They are very alarmed and like they look too much into things. And then coming back, processing the whole thing, it becomes like an effort for them. So they become very sensitive towards everything, physically as well as emotionally. And we don't see, rather, mostly it is seen that it's just that they have been through cancer, so they're physically not well. Physically not well. That's the whole thing that goes on. And a lot of times, even the person who's experiencing these things cannot quite put a finger on these things. Probably if you tell them, they may relate. Yes, this is what I experienced, but they don't know how to put words to it. Whereas for people who are caretakers or the close relatives of a person who has had cancer, for them there's a different kind of emotional fatigue. For them, they're exhausted taking care of the person. They have no time for taking their sense of care. There's no self-care for them. There's no respite for them. They're constantly devoted towards taking the care. Or in case of person who has somebody who has been through cancer, for them, seeing them doing things, it's exhausting. It's devastating for them. And they see that this is altogether a different person. The things they used to do, how they used to be. So it's not something they can process. So even they need the emotion, they need to take care of their emotional self, the emotional well-being. And the way that these all of can go together is very different. But the things that can be generalized is acceptance of the situation that they are in, the feelings that they have, to recognize these feelings, to recognize what's going on, and to prevent the dirty discomfort that comes with it. Now, you'd be wondering what dirty discomfort is. So, dirty discomfort is you are experiencing a feeling like suppose you went out and you're feeling all anxious about things. because you're meeting out people. Suppose meeting your own friend that you know for all your life, going to meet them after such a long time, after everything has happened. You're anxious and you're trying to fight that anxious, and probably at some point you're trying to cover up anxiousness with something else and start thinking, oh, I should not be feeling anxious, and you try to switch yourself. But then, even at some point after switching, the anxiousness is still in the background and you feel kind of guilt and shame with it. Or maybe after you've had the visit and you come back home, you feel guilt and shame attached with that emotion, that why did I feel this way? Why did I do this? Why did I do that? Why is it like this? This is referred as dirty distress. There's distress and guilt and shame is attached. Now, if you had anxiousness and you accept it, like, yes, I'm anxious about things, and you deal in a certain way that, okay, I have anxiousness, and you communicate it, or your acceptance, say, okay, I am anxious. That's kind of clean discomfort, that you're in acceptance with the comfort that you have. Putting your discomfort in the background or stuffing it in, or like not acknowledging discomfort, is this dirty discomfort. So dealing with that, coming on terms with that is important. Another thing is that do something that makes you feel happy. So throughout the treatment, there's this phase where most of the times, rather than feeling sad, you feel numb. You don't feel anything at all. And it's plain and stagnant. And over time, it has just become the part of your life. It's all stagnant, it's all numb for you. Nothing makes you happy anymore. Nothing makes you sad anymore. It's just plain. It's just flatline, emotionally flat. Probably only times you experience something is when there's a lot of crying. That's the only thing, and the pain is something that you can feel. So engaging in activities that makes you happy. Probably doing things that used to make you happy before, or maybe trying something new that can give you a sense of joy, should be done. You can keep on trying and experimenting with things. So it kind of is a new way of living for you. It keeps you afloat. It helps you with keeping happy. Now, being happy is associated with better cognitive functions and better healing. It helps you heal better. So in a way, it helps you recover from cancer too. Apart from just feel good, even bodily wise, it helps you recover with cancer. So it is important that you engage in activities that gives you a sense of joy. Apart from that is to learning to tolerate distress, called distress tolerance, to increase your distress tolerance. Now, when I say increase the distress tolerance, it does not mean that you have to keep on taking the distress, that you have to increase your threshold for taking in the distress. Increasing your distress tolerance, it refers on to accepting things and proactively doing things that can help you counter your distress. For example, in this case, you have known that you have cancer. So now we have to come on terms with the fact that, okay, I have cancer. What now? What are the things that's going to help? What are the things that I can do? What are the things that I cannot do? Knowing helps you what's not good for you, what's good for you, and can help you increase your abilities to do things and deal with the distress that comes. So when you are all equipped, when you have better tools, and when you know things better, you're in better capacity to deal with the distress. That is increasing your distress tolerance. Moving on to cognitive. So as we discussed earlier, making cognitive reserves, having knowledge of learning things, doing things, trying different things, can help you create a cognitive reserve. Yes, I was coming to that topic. That's what's the next topic. So to deal with this, sometimes you don't have emotional support, or sometimes the people around you are not in the capacity to provide you emotional support the way you need. The social support that is needed is not provided, or people around you are not in the capacity to provide it the way you want. Generally speaking, so people say that social support is needed, but a lot of times by social support, people generally think pushing the cancer patient or the cancer survivor into social things and making them participate into things. No, that's not. You are rather making things worse for them. A lot of times, cancer patients need social support in the way that there's somebody who they can talk to, tell their feelings, make them feel home, be comfortable with, can confide in with things to sit and process things. And generally, it is seen that the caregivers or the people in the or people who know or have relatives that have cancer are themselves exhausted or not in have strength, emotional strength to do this. They are themselves not on terms with this, so they are not able to provide this to them. Even they may cause a crime, or they may have a trigger, or they may be too emotional traumatized to deal with this thing. A lot of times they are in denial. So in these times, seeing a therapist or a counselor really helps. Also, when we talk about seeing a therapist or counselor, it is important that somebody who is well versed with the situation, who has dealt with these things, is needed. Because a lot of times there's a lack of context, there's a lack of understanding of how things can be. So that can rather backfire. So it is important that when you seek therapy, the context is to be understood by a therapist. The situation is understood by therapist. And a lot of times it is important that there's a clear communication. Going to a therapist, and if your needs are not met, if you are not able to communicate your things properly, that's again not good. So it is important that when you go to a therapist, you go and check the background, you learn. Like for example, we at Elysium of Mind, we have patients who have come through this, and we have the knowledge, ability, skills, and tools to deal with this. It's healthier, it's effective, and there's no thing that goes around the way. That we know the context, that we know how things happen and how they go about the things. The pace, it goes easier, it flows naturally. It's more easier and comfortable for both therapists and trying to do it. Also, asking to what extent. Normally, it is advised that soon as you start experiencing things, you sense of withdrawal during the treatment. It is better to treat them. So you have better ways to deal with it. But generally, even the people who see a therapist or go for mental health is generally after they are done with their cancer, when they are cancer survivors and it's been a long time, and they are having significant distress that it's come to a point where they have to take the help. They're exhausted and depleted. So rather than going to that point, it's needed that when you actually need help, when you feel like things are not working for you, you need help, you need somebody who could understand your context, that's when you go, that's when you seek help. So you are in better energy and resources, and you can cope with things healthily. I hope that answers your question. Yeah. Also, the thing is, a psychologist and a psychiatrist. So a psychiatrist mostly deals with medications and less of therapy. However, there's certain amount of psychiatrists that actually do therapy, whereas a psychologist would treat you through therapy, different forms of therapy, and mostly it's talk therapy. They have different forms: CBT, ACT, EDC. Yeah. Apart from that, environmentally, taking care of your environment, the environment that you are in, your surroundings, etc. In research, it's shown that people who have spent time in nature, When I say nature, it does not mean forest or something, but even in spending time in gardens or being around their house plants, being around live plants and animals, being in nature, being by the sea, anything that is nature has improved their mental symptoms. It has reduced their anxiety. And when I say anxiety, not the diagnosis, but the symptom, anxiousness. There's a calming sense to one's anxiousness, reduction in one's anxiousness, and not the disorder. It enhances mood and lifts up, sense of feeling of lifting up. So spending time in nature or doing aromatherapy. Now, aromatherapy, you might have heard about. So you burn a candle or you lit something that is made of natural things, natural oils and everything. They have scientifically it is true that certain kind of aromatherapy helps reduce the anxiousness. It calms you down and also decreases the amount of cortisol in your body and increases serotonin and dopamine levels in your body. Apart from these things, it is also important to have the environmental accessible for them. So for survivors or for the patients, having ergonomics, things that can help them function better, probably having a wheelchair or walking stick or installing a bar in their bathroom, a handlebar, something to hold on to, or things that makes their functioning better, easier, and makes them independent to do their own. Somewhere they're not dependent on somebody else for their help or assistance is needed. Anything that facilitates them and makes them feel independent can help them boost their sense of self and make them feel better. That is to be done. And also noise management. Now, noise is something that increases your distress. When you're already in distress and you have noise going around, it just amplifies your distress. So it is to be taken care of that the environment that you are in has noise, less noise, or no noise at all. Probably if you're traveling somewhere or you are in public place and the noise or the environment surrounding is causing distress to you, and there's no way you can move from there. So having things like noise cancellation things, or plugging earphones, or isolating yourself from in that environment can be helpful. Even in general, keeping your environment quieter and better helps with your neural functioning. So it is reported that calmer environment helps with better neural functioning. It gives a brain and it is relaxing, smoothing, and reduces your anxiety. It reduces your distress. So doing that is also a thing that can help you. It's not something that is actively but passively helps you. And the last is relational. So like we explained, it is something that is covered in the question that one of the participants asked. Relational. So social support is something that is needed to prevent distress. The more we are surrounded with people we can more relate to, can understand the situation and help us with the things, the better it is for us. But generally, it is perceived in a different form. When they say provide social support, normally it is perceived or misunderstood as involving them in more social situation, pushing them, making them do things, making them the limelight of things. No, doing that makes things worse for them. They're already anxious, their sense of self is wrecked. They don't know how to be. Like in general, they don't know how to be. Their whole sense of being is lost or is scattered here. And pushing them here like this, it makes things more worse for them. So emotional support is needed, social support is needed in the way that the person needs, the way the cancer patient or survivor or the caregiver needs. Communicating the way that are needed is to be done. Also helping them communicate better, helping them learn what they need, what they want, what they're struggling with. Learning these things can help them gain the social support that they need. And it's also easier for the person who are willing to help them effectively. So communication is another thing that is to be cultivated and developed. Seeing a therapist helps when you have nobody, or maybe then the support that you have is not actually supporting or is unable to support in the ways that you need. A therapist who is well versed with the situation, with condition, a psycho-oncologist or oncologist or a psychologist who has well versed with the situation, has experience with dealing with people with cancer, is better. To confide in them, to learn, process, grow, and heal with them is better. To learn skills with them is suggested. To undergo therapy, unbox things, unclutter things, and grow things again back is something that is advised, something that is necessary, something that is supposed to be done but is not done enough. The whole role about cancer health and cancer and mental health is seen that people suggest a lot of things but not therapy. Like there's still a lot of stigma and resistance against therapy. They are willing to provide the social support but not the therapy. Therapy is something that is beyond social support, that's beyond making you feel good, that's actually helping you work on your issues, helping you grow out of your habits, is helping you get through things, needing what you want, helping you get there. It's resolving of your trauma, and also it's like maintenance of your sense of self. You're going there, you're working on issues, and you're learning how to not repeat them, things that harm you, how to tackle them, how to dodge them, how to deal with them. So there's a lot of things that happens in therapy. Therapy is beyond just talking things out, beyond venting. Learning to communicate, learning to have boundaries, learning to improving your sense of self-worth is something that is to be done. And also for caregivers, therapy for caregivers is also needed since they are emotionally exhausted. And even like they are the ones that are mostly overlooked. Like a lot of care is provided for the cancer patient, considering they are in distress. But caregivers are the ones that are looked out, are ignored. Counseling cancer patients and counseling cancer patients and caregivers play a vital role in keeping mental health steady state, isn't it? Yes, it does. So counseling, yes, counseling is like attending to your brief therapy. It does help in every stage. The earlier you start, the better the functionality is. So the whole concept is the earlier you start, you can retain a lot of things and make whatever the damage is or whatever the things have changed can be repaired, can be worked upon. And something that is more manageable or something that works better for you can be done, can be learned. Whereas the later you come, there's a lot of things that has to be worked upon. It's distressing for you again to go through them, visiting them again. So it's a lot of task and it can tend to get lengthier and more painful for the person to come out and come on terms with. So an early intervention is helpful, but however, an intervention is better than no or delayed intervention. So that's all. Here we conclude. And if there's any doubt, any questions that you need, you can contact to us at elysiumofmind.com or on Instagram handle elysium_of_mind. And for whatever queries that you have, you can contact us. I hope you like the presentation and thank you.
Thank you so much, Hely. Thank you so much, Hely. So that was wonderfully explained, the difference between psychologist and a psychotherapist. I'm pretty sure that most of them were not aware about that. So thank you so much.
You're welcome. If anybody has any doubts or questions that they need to ask.
I think that's it. So in case if someone wants to contact me, contact you. So I will definitely give their number on the group. So that's all right. So they can always, in case if anyone have any doubt, so please let us know so that we can give the contact number of Hely as well. Yeah, thank you so much, Hely, once again. So I think it's time to wind up the session, and thank you everyone for being a part today. And I'll see you guys next week. Thank you.